Welcome back to the deep dive. Today, we're kicking things off with something that, well, it almost sounds a bit too neat, doesn't it?
It does.
What if taking care of your overall health, like really focusing on exercise and what you eat, could actually protect the very roots of your teeth from chronic infection?
Yeah, it's a fascinating idea. It sort of pushes preventative health right into the realm of dentistry. Our mission today is to really unpack this very detailed study. It suggests a powerful combination therapy for something called chronic apical periodontitis, or KTP.
KTP, okay.
And the therapy doesn't involve drilling or, the usual dental procedures, at least not at first. It's about balancing the body's own immune system.
Right, and we're basing this whole deep dive on some serious research. This isn't just anecdotal.
No, absolutely not. It's published in scientific reports.
Yeah.
The work was led by Rogério de Castillo's team at the Aracatuba School of Dentistry. That's at São Paulo State University, UniFEP.
FOA UNESP, got it. And supported by FAPE-SP, the São Paulo Research Foundation, so solid grounding.
Very solid. This isn't just, general be healthy advice. They're looking at a specific mechanism for a specific disease.
Exactly. And the big aha moment here, the thing we really want to explore, is the synergy they found. How moderate, regular physical activity in this specific study, it was swimming for 30 days. How that combines with a specific supplement, omega-3 fatty acids.
Right. And how that combination profoundly modulates or adjusts the immune system.
So we're literally connecting, say, your swimming routine or your fish oil capsules directly to the microscopic health of your jawbone, preventing serious mouth disease.
That's the core idea. It's quite compelling.
Okay, so before we jump into the swimming and the supplements, let's define the target here. What exactly is this chronic apical periodontitis, the CAP, that they were trying to combat?
Right. CAP is the bullseye. And yeah, the name sounds technical, but the condition itself? Surprisingly common. It's specifically inflammation right at the apex. It's the very tip of the tooth root.
The very bottom point.
Exactly. And in the tissues immediately surrounding that tip, the periapical tissues.
Okay, and how does an infection typically start its journey way down there? I mean, it seems quite protected, usually.
Well, the most common starting point, overwhelmingly, is just an untreated cavity, dental caries.
A regular cavity that someone maybe didn't notice or didn't get filled?
Precisely. If that decay gets deep enough, and sometimes it can happen without much pain initially, the bacteria basically drill their way down. They get through the enamel, the dentin, into the tooth core, the pulp chamber.
Where the nerve is.
Yes, and then down through the root canal system until they reach that exit point at the very bottom, the apex. Once those bacteria set up shop there, the body's local immune system kicks into high gear, trying to contain them.
And that immune response, while it's trying to help, actually causes the main problems, doesn't it?
That's the paradox. You get the infection itself, obviously, with the bacteria.
Right.
But the second major issue, and often the more damaging one long-term, is the loss of bone tissue right around that root tip.
Bone destruct.
Yes, the body initiates this bone breakdown process. It's called resorption, partly as a way to clear out the infected tissue, but also because the inflammation itself signals for bone removal.
So the ultimate risk, if this goes unchecked, is that the bone holding the tooth in place, the alveolar bone, just dissolves away.
That's the end game. If that supporting structure degrades too much, the tooth starts to feel loose, it becomes mobile. Eventually, it might become non-functional, painful, or even just fall out.
Wow. And you mentioned it's often chronic. What makes CAP so sneaky?
Yeah, its stealthy nature is key. Professor de Castillo in the source material calls it a silent threat.
Silent threat, okay.
Unlike, say, an acute abscess that gives you that throbbing, immediate pain you can't ignore, CAP is often chronic. The inflammation smolders, the bone loss happens slowly, maybe over years, and the patient might be completely unaware because there aren't necessarily any obvious symptoms day to day.
That seems incredibly dangerous. You don't know the damage is happening until it's potentially quite severe. What flips the switch? What makes it go from that sort of quiet battle to a full-blown crisis?
Often it's linked to changes in the person's overall health, their systemic immunity.
Okay.
So if someone's immune system takes a dip, maybe they get another serious infection somewhere else, or their hormonal shifts, or even just a period of really intense stress.
Right.
That can allow this simmering chronic infection to suddenly flare up, to evolve, as the researchers put it, and become acute.
And that's when you get the classic symptoms everyone dreads.
Exactly. Intense, localized tooth pain, maybe pus forming near the gum line, sometimes even quite dramatic facial swelling if the infection breaks out of the bone.
Okay, so we've got this localized, often silent, chronic infection at the tooth root. But now we hit this really critical point you mentioned earlier, the bidirectional systemic link.
Yes.
Can you break that down? Why isn't this just a problem contained within the jaw?
This is really central to why this study is so important for everyone, not just people worried about their teeth. It's a two-way street of inflammation.
Two-way street. How so?
Well, first, the research makes it clear that CKP itself, the severity of it, can be made worse by systemic conditions, things that affect the whole body's inflammatory state.
Like what kind of conditions are we talking about?
The study specifically mentions things like diabetes, metabolic syndrome, arteriosclerosis, hardening of the arteries, and even kidney disease.
Okay, so how does having, say, poorly controlled diabetes make a tooth root infection worse? What's the connection?
It boils down to the body's overall inflammatory load and how well the immune system is functioning. Systemic diseases like diabetes, especially if they're not well managed, create this background noise of chronic low-grade inflammation throughout the entire body.
Like a constant simmer.
Exactly. Your blood might be carrying higher levels of pro-inflammatory signals, these molecules called cytokines. So when you have a local flare-up at the tooth root, the immune system responding is already kind of primed, or maybe even worn out, by this systemic background noise.
So it either overreacts or underperforms.
Right. It might react too aggressively, causing more collateral damage like bone loss, or it might just not be efficient enough to clear the infection properly. Either way, the CIP can become more severe, progress faster.
Okay, so if your general health isn't great, if you've got high inflammation levels systemically, that's like adding fuel to the fire at the tooth root.
A really good analogy. But here's the other direction of that two-way street. The infection in the mouth isn't just sitting there passively getting worse. It actively contributes back to the systemic problem.
Ah, so the tooth infection itself makes the other conditions worse.
Precisely. That chronic bacterial load right there at the apex, and the constant production of those inflammatory cytokines locally, it doesn't all stay put. It acts like a persistent source of inflammation that can leak into the bloodstream, adding to the body's overall inflammatory burden.
So the inflamed tooth root is actively aggravating your diabetes or your kidney disease or your arteriosclerosis.
It seems that way. It helps keep that systemic inflammatory fire going, which is why the idea of treating this local dental issue with systemic approaches like exercise and nutrition
Becomes really interesting. You're treating the whole system to fix a local problem, which in turn might help the whole system again.
Exactly. It's an integrative approach, potentially treating the body by targeting this one focal infection.
That makes perfect sense and really sets the stage for this UNSP study. If this mouth infection is tangled up with the body's overall inflammation, then maybe tackling that overall inflammation can help the tooth.
That's the logic.
So let's get into the study design. How do they actually test this?
Well, they needed a controlled setup, obviously, so they used lab rats, 30 of them. They first induced apical periodontitis in these rats.
Gave them the tooth root infection artificially.
Yes, in a standardized way. This allows for really precise comparisons later on. Then, they divided these 30 rats into 3 groups.
Okay, group 1.
Group 1 was the control group. They got the infection, but then nothing else. No specific exercise, no special diet, just the baseline infection.
Standard procedure, group 2.
Group 2 was the exercise group. These rats also had the infection, but they were put on a specific, pretty rigorous physical activity plan.
Which was the swimming you mentioned.
Yes, a 30-day swimming regimen. And it's important to note, in these kinds of studies, swimming is a well-established way to induce moderate to vigorous aerobic exercise in rodents. It reliably triggers cardiovascular and immune system changes.
So not just a casual dip, it was structured exercise.
Definitely. And then there was the third group, the combined group.
The one they were really interested in.
Right. This group did the exact same 30-day swimming routine as group 2, but they also received dietary supplementation with omega-3 fatty acids.
Okay, so they could isolate. What does just exercise do? And what does exercise plus omega-3 do compared to doing nothing?
Precisely. A very clean comparison.
Let's focus first on group 2, the exercise-only group. Before we even bring omega-3 into it, what did just the swimming achieve over those 30 days?
Well, the data showed that the physical exercise, all by itself, led to a noticeable systemic improvement in the rats.
Systemic meaning?
Meaning better overall metabolic health markers, maybe better glucose control, things like that, and critically, a reduction in general systemic inflammation markers throughout their bodies.
So the exercise made the rats healthier overall, systemically.
Yes, that's the foundation. And this overall improvement then translated to local benefits. right there at the infected tooth root.
How so? How did being generally healthier help this specific tooth infection site?
It seems the exercise helped regulate the local immune response. Compared to the control group rats who did nothing, the exercise rats' immune systems responded to the bacteria, but more efficiently, less chaotically.
Less collateral damage.
Kind of like that, yeah. They avoided that excessive, self-destructive inflammatory cascade you often see in chronic infections. So even without any supplements, the swimmers had measurably better outcomes than the controls. Their bodies handled the infection with less destructive inflammation.
Okay, that's interesting. Now, the key issue with CAP is the bone destruction. Did the exercise alone manage to slow that down? Did it protect the bone structure?
Yes, and this is a really crucial early finding. We talked about bone resorption, the breakdown of bone, and the cells responsible, the osteoclasts.
The demolition crew.
The demolition crew, exactly. They get called in by inflammatory signals.
So what happened with the osteoclasts in the exercise-only group?
The researchers actually counted them, or markers for them, in the tissue samples. They found significantly fewer active osteoclasts in the exercise group compared to the control group.
Fewer demolition workers on site.
Precisely, which is a direct physical sign that less bone was being destroyed. It shows that exercise alone was already influencing the immune signals that recruit osteoclasts. It was providing real localized protection to that alveolar bone.
That's pretty powerful just on its own. Regular aerobic activity impacting bone health right down at the tooth root level, even with an active infection.
It is. It tells us that our lifestyle choices have these very specific localized effects.
But the main hypothesis was about this potential synergy, right? Did adding the omega-3 on top of the exercise really boost this protection?
That was the big question. And first, you had to understand why they chose omega-3.
Right, it's not random.
Not at all. Omega-3 fatty acids, especially the long-chain ones you find in fish oil, like EPA and DHA, they are very well-known, widely researched compounds. They have documented therapeutic effects in many chronic inflammatory diseases, think arthritis, heart disease. They're known to be anti-inflammatory and also help in resolving inflammation, cleaning up the mess afterwards.
So the researchers were essentially thinking, we have exercise, which seems to regulate the immune response systemically, and we have omega-3, a known potent anti-inflammatory agent. What happens if we put them together against this specific tooth root inflammation?
Exactly. Would it be additive or even better, synergistic, where the combined effect is greater than just adding the two individual effects?
And what did they find?
They found clear synergy. The results from the combined group, the swimmers, who also got omega-3, were consistently superior. This group managed to regulate the immune response and control the infection even better than the group that only exercised.
Significantly better.
Yes, statistically significantly better when compared to the control group, and also showing trends or significance over the exercise-only group in key measures. It really pointed towards a cooperative action between the exercise and the supplement.
The first author, Ana Paula Fernandez-Ribeiro, she summarized it quite directly, didn't she? Something like the combination further reduced the destructive condition.
Yes, caused by the endodontic pathology. A clear conclusion that the combo was superior in fighting the disease's damage.
Okay, that's the top-line finding. Can we dive deeper into the mechanisms? Like, how did this combination achieve that superior result? What was happening at the cellular and molecular level?
Absolutely. To really see the difference, we need to look at the immunohistochemical analyses they did.
Okay, that sounds technical. What does it mean?
It's basically using special stains and antibodies to light up and measure specific molecules and cells right there in the tissue samples from the tooth root area, the periapical tissue.
So, like taking a molecular snapshot of the inflammation battlefield.
Exactly. It lets you see who's there and what signals they're sending.
And what specific signals, what molecules were they tracking to gauge how bad the inflammation battle was?
They focused on two really important pro-inflammatory cytokines that are known to drive the bone destruction in CAP.
Cytokines, again, those signaling molecules, which ones?
Interleukin-17, usually written as IL-17, and tumor necrosis factor alpha, or TNF.
Okay, IL-17 and TNF-alpha. Why are they the villains in this particular story?
Well, TNF-alpha is kind of an early responder, a major initiator of inflammation. It ramps things up quickly. But if it stays elevated chronically, it's a huge driver of tissue damage, and it directly tells those osteoclasts, the bone destroyers, to get to work.
So TNF-alpha calls in the demolition crew. What about IL-17?
IL-17 is more involved in certain types of T-cell immune responses, and particularly in chronic inflammation. If IL-17 levels stay high, it helps perpetuate that cycle of destruction that you see in chronic conditions like CAP. It keeps the inflammation going and also contributes to bone loss.
Got it. So by measuring both TNF-alpha and IL-17, they're getting a picture of both the immediate inflammatory punch and the ongoing chronic damage potential.
Precisely. It gives a good overview of the destructive signaling.
So how did the three groups compare on these two key markers?
The results showed a really clear pattern, a hierarchy of protection. The control group, the ones with the infection and no treatment. They had, as you'd expect, moderate to high levels of both IL-17 and TNF-α. The inflammatory battle was raging uncontrolled.
Okay. The exercise-only group.
They showed lower levels of both cytokines compared to the controls. The swimming had definitely dampened down those destructive signals.
But the combined group, exercise plus omega-3?
They had the lowest levels, significantly lower, in some cases approaching the levels you might see in healthy, uninfected tissue.
Wow. So the combination drastically cooled down the inflammatory signaling right at the site of infection.
Yes, it demonstrates a much better regulation of that potentially damaging immune response.
That's strong chemical evidence. But did it translate into saving tissue? We heard exercise alone reduced the osteoclasts, the bone destroyers. Did the combo therapy do even better on that front?
It did, and this cellular activity part is maybe the most exciting finding for potential future use. While the exercise group had fewer osteoclasts than the control, the combined group consistently showed even fewer. They had the lowest count of active osteoclasts overall.
So they were minimizing the actual bone destruction most effectively. They really put the brakes on the demolition crew.
Exactly. Maximum braking power on bone loss.
Okay, slowing down destruction is huge. But healing isn't just about stopping damage, right? It's also about repair and maintenance.
Yeah.
Was there any sign the combined approach was helping with the cleanup or rebuilding phase?
Yes, and this highlights the synergy beautifully. It wasn't just about inhibiting the bad stuff, it was also about supporting the good stuff. The combined approach specifically seemed to boost the activity of fibroblasts.
Fibroblasts, those are the cells that build things, right? Like collagen.
Precisely. They are the tissue architects. They synthesize the extracellular matrix, the scaffolding of the tissue. They are absolutely essential for maintaining tissue structure and for any kind of repair or healing process.
So the exercise plus omega-3 didn't just slow demolition, it also called in more construction workers, or at least made them work better.
That's a great way to put it. The data suggested that the combination, perhaps particularly the omega-3 component known for aiding inflammation resolution, helped nudge the tissue environment away from chronic destruction and more towards maintenance and potential repair.
That's a fantastic dual benefit. Suppress the bad guys, boost the good guys.
It's the ideal scenario for managing chronic inflammation, not just stopping the fire, but helping to rebuild afterwards.
And this wasn't just based on counting cells or measuring chemicals, was it? Didn't they also get actual pictures, physical evidence?
They did. They used microcomputed tomography. Think of it as super high-resolution CT scanning, often called micro-CT on the rat's jaws.
So they weren't just looking at markers, they were measuring the actual physical structure.
Exactly. They could precisely measure the volume of the alveolar bone, that's the bone socket that holds the tooth right around the infected root tip. They could quantify how much bone had been lost.
That's the ultimate proof, isn't it? Did the bone actually survive better?
The results were undeniable. The micro-CT scans provided tangible, physical proof. The animals in the control group showed significant loss of alveolar bone volume, as expected from the infection.
Okay.
The animals that only swam showed less bone loss than the controls. The exercise protected the structure to some degree.
And the supplemented group?
The bone loss was even less in the combined group, the ones who swam and got omega-3. They retained the most bone structure around the infected tooth.
So the benefits they saw at the molecular and cellular level directly translated into physically preserving the tooth's support structure. The synergy literally saved bone.
Yes. It provides very strong evidence for the real-world protective effect of the combination.
This is incredibly detailed work. It really drives home that point about how our overall health habits can impact these very specific microscopic disease processes. Okay, let's transition now. Section 4. What's the big picture here? What's the so what for someone listening to this?
Well, to sum up the benefits clearly, this combined approach, the swimming plus omega-3, it hit on 4 key protective points against this chronic tooth root infection. It regulated the immune signals. It minimized the bone breakdown by reducing osteoclasts. It balanced out those destructive inflammatory molecules like IL-17 and TNF-α, and it boosted the activity of fibroblasts, the repair cells.
That's a comprehensive win. So why should the average person listening care about this, especially if it's a rat study with swimming? Maybe they don't have a toothache right now.
Because this study provides really the first piece of evidence demonstrating that this specific combination, moderate exercise and omega-3 intake, can significantly reduce the specific inflammation tied to this common, often silent dental disease, CAP.
It takes it beyond just general health advice.
Exactly. It strongly reinforces the idea that your everyday health practices, your diet, your fitness routine, they have direct, measurable, and highly positive consequences for these localized chronic infections, even the ones hiding out deep in your jawbone that you might think only a dentist can deal with.
So it shifts the motivation, perhaps. It's not just, I should exercise to feel better, but maybe my regular run and my fish oil could actually be protecting the bone around my teeth from the infections I don't even know I have.
It connects the dots in a very tangible way. It links that systemic health loop directly to specific dental outcomes. And think about it, if you're already managing another chronic inflammatory issue, maybe arthritis or metabolic problems, this suggests that your efforts with diet and exercise might be delivering an extra benefit, helping control these hidden oral infections too.
That's a powerful idea. Now, we do need to be careful translating this, right? It was rats. It was forced swimming. How much can we really extrapolate this to humans going for a jog or swimming laps voluntarily?
That's the absolutely essential scientific caution. And the researchers themselves point this out. One of them, Jacinto, is quoted saying basically, look, to know if this holds true for humans, we absolutely need clinical studies, proper trials with a significant number of human patients.
Right. Human validation is key.
That step is crucial before you can say this is a proven therapy for CAP in people.
So bottom line, we can't tell people, skip the dentist, just swim and take fish oil if your tooth hurts.
Definitely not. But even without those specific human CAP trials yet, does the study still offer a valuable takeaway right now?
What do you think?
I think absolutely. Because even setting aside the specific CAP connection for a moment, the study provides yet another strong piece of evidence reinforcing what we already know from lots of other research. Physical exercise and omega-3 consumption are generally fantastic for regulating the immune system and tamping down systemic inflammation.
It adds more detail to the picture we already have.
Exactly. We know these things are good for overall inflammatory balance. This study just gives us really granular proof that they work against this very specific, tricky type of localized chronic inflammation too. It adds a new dimension to their known benefits.
So it validates those healthy habits again, but with this extra microscopic layer of detail about protecting bone in your jaw, it kind of elevates lifestyle choices, doesn't it? It makes them feel more like a targeted preventative strategy.
Yeah, an integrative strategy, making sure your body's own regulatory systems are tuned up to handle infections better and minimize the damage when they inevitably occur.
It really frames basic healthy living as smart, cost-effective preventative medicine. The mouth isn't separate, it's part of the whole system.
Beautifully put. The mouth is absolutely part of this system.
Okay, that brings us towards wrapping up. Let's quickly recap the core finding one more time.
Sure. The key finding was that combining a 30-day moderate aerobic exercise program, in this case swimming, with dietary omega-3 supplementation created this potent synergy.
Synergy that did what specifically?
It radically lowered markers of inflammation, reduced the presence of bone-destroying cells, boosted repair cells, and ultimately prevented structural bone loss in this model of chronic dental infection. Much better than either exercise or doing nothing.
And the mechanism was fundamentally about regulating the immune response, dialing down the destruction while promoting maintenance and repair.
That's the essence of it.
Okay, now let's circle back to that really important concept we established early on, the bidirectional link, the two-way street. We learned that chronic inflammation hiding at the tooth root, that silent threat of CAP, isn't just a local issue. It can actively feed into and worsen major systemic problems like diabetes, metabolic syndrome, maybe even kidney disease.
Right. The oral infection is constantly pouring a little bit of fuel on the systemic fire.
So here's the final provocative thought we want to leave you, the listener, with today. If we now have evidence suggesting that adopting a lifestyle with moderate, regular exercise and sufficient omega-3 intake can significantly cool down the inflammation caused by CAP at the tooth root, Could this lifestyle approach then be serving as a kind of inexpensive dual-action preventative therapy? Could it be protecting not only your teeth and jawbone, but also simultaneously reducing the inflammatory burden on your entire body? Maybe helping protect your kidneys, your arteries, partly by addressing that hidden source of inflammation in your mouth.
It really pushes you to think about health holistically, doesn't it? Managing your fitness and diet isn't just about weight or heart health in isolation. It could be the most comprehensive, affordable way to manage chronic inflammation everywhere, right down to the microscopic tips of your tooth roots.
A fascinating feedback loop to consider. Well, that certainly gave us a lot to chew on. Mission accomplished for this deep dive. We hope you found that as interesting as we did. Join us next time.